Hi everyone, my name is Dr. Santosh Kumar Gupta from Medesun Medical Coding Academy. Today we are going to discuss about the Singapore medical coding. Guys, please concentrate. It's a very good opportunity for all medical coders and novice coders to work in Singapore. So I'm going to explain you exactly about the Singapore medical coding and what are the career opportunities and how to work in Singapore. So watch complete video to get more details and please subscribe this channel to get the updates every time. Medical coding in Singapore. In Singapore, they follow ICD-10-AM, ACHI and ACS. ICD-10-AM means International Classification of Diseases, 10th revision, Australian modification. Please make a note. You are learning all this is about the clinical modification, which is for the American healthcare system. You have to learn about the Australian modification. ACHI means Australian Classification of Health Interventions. ACHI is for the procedures. So how we have CPT for the American the American medical surgical procedures, the same way we have the ACHI for the Australian surgical procedures. Next, ACS means Australian Coding Standards. See, in ICD-10 CPT we have coding guidelines. In the same way, ACHI has some coding guidelines. ICD-10-AM has some coding guidelines. So these are mentioned in the ACS, that is called Australian Coding Standards. So if you want to work in Singapore, you should have a expert knowledge in the ICD-10-AM, ACHI and ACS. And what is the eligibility to get job in Singapore? Eligibility is any life science graduation, especially like microbiology, biotechnology, biochemistry, B pharmacy, M pharmacy. Pharma D is very much in demand. Nursing candidates, medical students like BAMS, BHMS, BDS, dentist, anyone expert in medical technology, you can get job easily in Singapore. So what is your responsibilities? Very simple. You have to assign the codes, ICD-10-AM and CM codes, CPT codes, ACHI codes, and following the ACS guidelines. In Singapore, you have to work more on the audit part. So you have to work on the DRG audits. And you have to learn more about medical records management. You should know how to communicate effectively with the healthcare providers. You have to apply the Ministry of Health guidelines and implement. So it's not only the coding, so you are responsible for the overall quality in the medical coding and medical records management following the national level and hospital level coding guidelines. AAPC, CPC and CCS. Yes. So AAPC, CPC is accepted throughout the Singapore and also CCS. So you can see this screenshot here on the right side. So Manson Healthcare in Singapore, they are asking about the CPC with experience of 2 to 3 years. So if you have CPC and CCS, no problem. You can get the job in Singapore, but you have to learn about the ICD-10-AM in detail. So what are the key skills you require? The key skills are especially DRG coding, ICD-10-CM, ICD-10-AM, CPT, ACHI and ACS. So you have to learn both American system and also US system to get job in Singapore. So what is the average salary? The average salary in Singapore is $2,200 to 4,500 Singapore dollars. It's a very good salary. You can see here on the screen. So the maximum salary may go up to 8270 Singapore dollars. See, you need only $1,600 to live in Singapore. So 8270 is a very good salary with experience of 4 to 5 years. Starting salary will be 2960. Average is $5480 and may go up to 8270. So medical coders experience of more than 3 to 4 years, CCS or CPC, excellent opportunity for you to work in Singapore. There is a huge demand for the skilled medical coders. Yes, so along with your experience and education like masters or doctor degree like pharma D, nursing, so automatically you get the very good salary in Singapore. Okay. So now I'm sure you know about the ICD-10-CM and CPT and HIPAA. So now you have to learn more about the ICD-10-AM and ACHI. So AM means Australian modification. We have 22 chapters. ACHI means interventions like procedures. We have 20 chapters. So IC-CM and AM is almost same, 80% same. But 20% you have to learn about the Australian coding standards. But the CPT and ACHI both are completely different. Okay, so you have to learn ACHI in detail. So to work in Singapore, you should know about the American coding system and also the Australian coding system. So any medical coder with CPC or CCS experience of more than 7 to 8 years, yes, you can try for a job in Singapore. There is a huge demand. So the duration for the Australian coding for the medical coders is 1 month, and for the novice coders we give training for 2 months. It's completely online training, Zoom with material, and the fees is 30,000 rupees. And we are going to provide you FIMC, means Fellowship in International Medical Coding, Australia Modification. So it's not only the training. So after this comprehensive training, you can take the HIMAA Australia Medical Coding Board exam. It is called CCC, Certified Clinical Coder. So this training helps you to pass the HIMAA exam. It is called Level 2 Intermediate Coding, and IC-AM will help you to get job in Singapore, Malaysia, New Zealand, Ireland, and Australia. So now you have the knowledge of the American coding system. If you can learn the Australian coding system, you can work in so many countries, especially Singapore, Malaysia, New Zealand, Ireland, and also Australia. So now see here, now you have the more opportunity to work globally. But keep in the mind, the coding system is same everywhere. 20% only you have to learn. Okay. So if you want to more coding details about the Australian coding, please watch for my next video, which is going to release on the 20th November 2022. Okay. So this is Medesun Medical Coding Academy. I am Dr. Santosh Kumar Gupta. But one thing I want to tell very clearly is a disclaimer that only having CPC, CCS with experience will not qualify to get a work visa. To work in Singapore, you require a sponsor or require a work visa to get a job in Singapore. So what you should do, you have to go to Singapore on tourist visa and you search for a job, and then automatically the employer is going to provide you the work visa. So what is the best way? Now you upgrade yourself to the Australian coding system, take training for 2 months online, and take the certificate of completion,